Okay, so we're going over types of white blood cells here, and you can see that the basophils, the eosinophils, the neutrophils, the Ben are filled with granules. If the name ends in fill, it's filled with granules. That includes the basophils, that they're basic. The B should also remind you of blue because they love basic. They're slightly acidic inside, so that basic dye, they like that. And that gives bluish purplish granules. The eosinophils are lovers of eosin, that reddish dye, that slightly acidic dye. And the neutrophils are neutral, so they take in a little bit of both, a little bit of the reddish, a little bit of the bluish purplish. And so their cytoplasm looks between the two in appearance. The big tip off for the neutrophil is the nucleus, the low, lumpy, broken apart into pieces that are connected by really fine threads, crazy shaped nucleus. Anyway, let's jump into them. All right, so there are three types of granulocytes: the basophils, the eosinophils, the neutrophils. Ben, they are filled with nucleus, and they are filled with granules in the cytoplasm, and they have fill in their name, so easy to remember. These are bigger than red blood cells, and they live less time than red blood cells. Lobed nuclei, they're not circular. They have these granules. They are filled the granules in the cytoplasm, and they stain with Wright's blood stain. We've talked about that. We've talked about the colors. Um, they like to eat things. So neutrophils, most common, 70% of all white blood cells, about twice the size of a red blood cell. Granules stain with both acidic and basic dye. That's because they're neutral, so they pick up a little bit of the acidic eosin, a little bit of the red, and a little bit of the basic blue. Anyway, but those granules are small. They're hard to see. What's easy to see in a neutrophil is the big lumpy nucleus, divided up into 3 to 6 lobes. Um, and let's move on. Okay, so phagocytic, their main job is killing bacteria. These are the first line of defense white blood cells. Um, they produce things like hydrogen or bleach. They also pull in, like literally eat things that need to be killed. They have defensin granules that will, like a phagosome is a vacuole created when you, a vessel is an organelle created when you pull something inside of you. It's in the phagosome. Well, they will then send defensins to join up into that phagosome, and those are little protein spears or protein membrane. They punch holes in. I usually compare them more to a donut that inserts itself in the membrane and then expands to leave a hole. But anyway, if you want to say it's a spear that the head goes in and then goes, fine, whatever works. Don't care. Uh, so here they are, and like I said, you see the color of the cytoplasm. When it's blown up this big, so the color is between red and the dark bluish purple. You can see granules when it's blown up this big, but the granules are hard to see. Big tip off for identifying them is the multi-lobe nucleus. You can see that each one of these lobes is connected by a thin little thread of DNA. So it is one nucleus. Just be sometimes when you're looking at a slide, they're so small it's hard to see these threads. All right. So eosinophils, that's the next of the granulocytes. These have big reddish purple granules. These granules are a lot easier to see because they're so much bigger. They are the second least common. The only less common white blood cell be the basophil. Anyway, the nucleus has 2 lobes, and they're connected by a little band of DNA. The book is comparing that to earmuffs. Okay, whatever works for you. Red granules that have digestive enzymes. These things go after worms. So if you are looking at a patient and they're doing initial blood work, but they're not sure what's going on, they could do a what they call a differential white blood cell count. You see the, oh wow, the number of eosinophils, it should be around like 2 to 4%, but it's around 20%. You don't even need to wait to figure out which worm. You just start prescribing a general anti-helminth medicine, something that kills lots of worms, and you switch over to a specific one later once the lab's done with the results. But those initial results tell you this person has a parasitic worm problem. Anyway, so they have enzymes in those granules that will digest worm surfaces to kill the worm. They also release histamines, so these are the ones that are keyed up and ready to go when you have allergies and asthma. They're just overreactions to things that don't belong. All right, so there we go. Basophils are the rarest. Remember, never let monkeys eat bananas. Well, bananas, that's the least common. And these should be less than 1% of all white blood cells in normal conditions. It says deep purple, 1 or 2 constrictions in the nucleus. The deep purple should tell you, those are the granules we're talking about. The large purplish black granules full of histamines. These are inflammatory. That means they cause the blood vessels to get bigger and more blood delivered to the location. That's what causes the redness. And when we have inflammation response, it's lots of blood being there, but that's because we're delivering lots of white blood cells to the area. Uh, anyway, there's a picture. It's blown up a little too big. It's a little fuzzy, but you get the idea. Agranulocytes, those are the ones without granules. That's going to be the monocyte, which is a baby macrophage, and the lymphocyte. I usually remember that saying, oh, well, the agranulocytes, they don't have any spots, any blemishes. Think of a famous person supposed to be beautiful. They don't have any spots or blemishes on their face. Think of the Mona Lisa. Well, that Mona Lisa, monocyte, lymphocyte. Anyway, their nucleus is either kidney shaped or round shaped. The lymphocyte tends to be round. The monocyte, which is bigger, tends to be kidney shaped. Also, it should help you remember the monocyte. The M should remind you this is massive. This is the biggest of the white blood cells. And the lymphocyte, it is little. That L is because it's the smallest. It's barely bigger than a red blood cell. Anyway, let's jump into it. So lymphocytes are the second most common. Remember, never let monkeys eat bananas. The let, second most common. In a healthy individual, it's just about 25% of all the white blood cells. Lymphocytes have a big nucleus. In fact, they are almost all nucleus. Thin blue ring of cytoplasm around them. But there's so much nucleus, you might not be able to even see the cytoplasm. You probably guessed they are called lymphocytes, and they hang out in lymphoid tissue. That means they hang out in the lymph nodes, they hang out in the spleen. You do have ones that circulate in the blood. The T cells are more likely to do that to travel. Anyway, but you have two different types of lymphocytes, T cells and B cells. They're actually named for where they grow up. The B cells grow up in the bone, and the T cells grow up, I shouldn't say grow up, both of these. When we say grow up, what I mean is mature and become immunocompetent, become aware of what they should fight and how to do so. Anyway, the T cells mature in the thymus and the B cells in the bone marrow. All right, so there we have lymphocytes, tiny. Monocytes, those are the biggest of all of the third most common, never let monkeys. Those are 3 to 8% of all the white blood cells. They have pale blue cytoplasm, big U-shaped or kidney-shaped nucleus, and they will leave the blood, go into the tissues, and grow up into macrophages. The name means the big eater. These are actively phagocytic. They go around looking for viruses, bacteria, parasites, any of those things they will attack and chew on, try to pull in and digest. So active lymphocytes will, oh, sorry, and one of the jobs of a monocyte is to wake up the lymphocytes. Hey, there's a thing here you need to react to. Help us fight. All right, so there we have an example of a lymphocyte. Sorry, of a monocyte. The lymphocyte was the little tiny one. Compare the size of this red blood cell and the size of this lymphocyte. You can see that it's not much bigger. Now this monocyte, huge in comparison, massive. Same picture you saw before, just to recap. All right, so now we'll talk about the making of the white blood cells. We did erythropoiesis, the making of the red blood cells before. Now we're doing leukopoiesis, the making of the white blood cells. And they are produced in bone marrow. When the bone marrow is stimulated by oh, I shouldn't say it that way. What the book is saying is production of white blood cells is stimulated by two types of chemical messengers from red bone marrow and mature white blood cells. So you have interleukins like IL-1, IL-3, and colony stimulating factors. And these are named for the white blood cell type that they get excited, get dividing. So granulocyte colony stimulating factor will stimulate granulocytes. All leukocytes are from hemocytoblasts. Remember, that's the blood marrow stem cell we talked about before. That is the start of all red blood cells. It's actually the start of all blood cell and cell fragment platelets. They all come from this hemocytoblast. And if we are making white blood cells, you could become a lymphoid stem cell, which will produce lymphocytes. The hemocytoblast will become a lymphoid stem cell, or it could become a myeloid stem cell that makes all the other stuff. So for making granulocytes, let's jump ahead to the picture. Here's our picture. All right, so the hemocytoblast could go into the, hemocytoblast at the top, go into the lymphoid stem cell side and make lymphocytes, or it could go into the myeloid side and make everything else here. And so everything we're doing is going to refer back, everything we're discussing is going to refer back to this picture, figure 1711. Definitely be familiar with this. I won't ask a huge number of questions about it, but I will probably ask. All right. So if we're making granulocytes, myeloblasts are going, you're going to turn the hemocytoblast into a myeloblast, which become pro-myelocytes. Remember, pro means before, so that means before you make the myelocytes, make the pro-myelocytes, then the myelocytes, then the band cells, and then the mature granulocytes. Their nuclei are segmented, they're pulled apart into the lobes that are connected before we release these cells in blood. 10 times or more are in the bone marrow than blood. That means if we release them in a hurry, we can have a bunch on held reserve. 3 times more white blood cells are formed than red blood cells, which is crazy because when you look at the white blood cells, Buffy code, and you look at how many red blood cells, you're like, how could that be? It's because they die fast. White blood cells live fast, glorious lives as heroes, dying to save the body. So their lives all get cut short fighting microbes. All right, we did granulocytes. Let's do agranulocytes. These are the production of the monocytes and the lymphocytes. Okay, so a monoblast will become a promonocyte, which will become a monocyte. This makes sense. Remember, I said blast is baby, a site would be older. Well, pro is a suffix that means earlier, before. So you're going to go from monoblast to, well, before the monocyte, which then becomes monocyte, which they share a common precursor with the neutrophils, and they can live for several months. Monocytes live for 3 months, so they live longer than the granulocytes. They live longer than the red blood cells. Well, not really. Since a red blood cell lives 100 to 120 days, I guess that does count as a few months. Now, the lymphocytes, we have memory ones that live forever. Live a long time. So T lymphocyte precursors become T lymphocytes that mature in the thymus, and B ones in the bone marrow. We already talked about that. We have memory B cells and memory T cells. These are ones that last for decades. They remember previous infections and help you mount a faster response because of it. So there's a pretty picture. All right. Many of the hematopoietic hormones, meaning hormones that help you to create blood cells, they're talking about EPO, or colony stimulating factor. They are used clinically. We can stimulate bone marrow patients' bone marrow by giving them these hormones after chemo, and those hormones will take the surviving tissue and make it more active. So they can also be used to increase protective immune responses if you have an immune system. Let's see. Overproduction of abnormal white blood cells. That's called leukemia or infectious mono. If you have a abnormally low white blood cell count, they call that leukemia, and it could be drug induced, especially anti-cancer drugs or corticoids. They interfere with the production. All right, so leukemia, you could have acute leukemia, and that's a problem with stem cells. It's bad. Mostly affects children. Chronic or slowly advancing, you have later cell stages that are trying to spread, and this is most common in older. If you don't treat them, leukemias will kill you. They are a cancer. What they do is you produce lots of white blood cells, but they're not matured, they're not differentiated, they're not capable of doing immune things, so you're filling the body with useless white blood cells to the point that you're not making normal white blood cells the amounts you should, you're not making normal red blood cells the amounts you should. So these cancer cells can fill up your bone marrow, crowd out other cells, cause anemia because you're not making the red blood cells you should, cause bleeding because you're not making the thrombocytes, the platelets that you should be, and death when it happens is just caused by internal hemorrhage or an infection. How do you treat leukemia? Radiation, anti-leukemia drugs, stem cell transplants. They're not mentioning it, but they should mention monoclonal antibodies as a means of treating leukemia. It's very promising, very, very promising. All right, let's see. Infectious mono, commonly called a kissing disease, Epstein-Barr virus.